I'm familiar with some folks here, so if you know me already, happy to see you again. You're Christofferson. Heart and Vascular Institute, Snyder and Whitewright here at the hospital. Take care of patients in our office there as well over at the cath lab here. So today, the topic that we've been given is heart health and the numbers you need to know. So there were 5 that were chosen that we discussed, but I'll be honest with you, you could add up more numbers than this. Doctors, we love numbers, so there's a lot more than 5, but 5 are kind of the basic 5 things to know about yourself, things that you might need to recognize that you could use to decrease your heart risk. So the first number is the blood glucose, and that is fasting blood glucose. This level will tell you what your risk is of diabetes. Now, diabetes is a significant risk factor for atherosclerotic disease. That's the hardening of the arteries, plaque. So the first number that I would suggest that you would need to know is your blood glucose while you're fasting. Second would be your body mass index. That's your weight over your height. There's a lot of debate about whether a BMI or body mass index is really the right way to go. Sometimes you have really big muscular guys or very thin people who have weight issues, but it's a general tool to help us recognize when patients have reached a weight that is unhealthy or unsafe for their body. We also often monitor another number, which is your blood pressure, and that's a systolic blood pressure. That's when the heart is squeezing, and the diastolic blood pressure, and that's when the heart is relaxing. And that blood pressure, those 2 numbers help me to decide and help your physicians and providers decide what is your risk of developing secondary to high blood pressure, such as atherosclerotic disease, like I find in the heart, or cerebrovascular disease in the brain, or even kidney disease can result from high blood pressure. That's the next number that I would like you to know. Next is cholesterol, your cholesterol number. There's actually 4 or even 5, but 4 major numbers in your cholesterol panel. Sometimes that can be a little bit confusing, good and bad. The bad cholesterol is the LDL, low density lipoprotein. And this is the cholesterol that helps cause plaque to form in your arteries. And it's very important to know that number. If you don't know it, your total cholesterol and your non-LDL cholesterol can give you that number, but LDL is the most important one. There's also triglycerides. Sometimes people get these mixed up. The last number that I'd like you to learn today or know about is the kidney function number, which be considered your GFR or your creatinine clearance. Those are other ways to put this. Major emphasis on whether you have protein in your urine or not. That's a number or an item of your health that you really should know. So moving on to blood glucose. A normal fasting blood glucose should be less than 100 milligrams per deciliter. This can be obtained on your panel when you go to the doctor and they get fasting chemistry, and it will show right up there glucose. You would like to see it under 100. If you're between 100 and 125, then your fasting glucose is considered impaired. Some folks might use the term pre-diabetes. It means that you're at risk, that you are not processing sugar as well. Your insulin and your pancreas perhaps not handling it quite as well. So it's a really warning sign. And if you have an elevated fasting blood glucose over 126 milligrams per deciliter, then that's indicative of having diabetes. We also have a little chart I put together, or I pulled up on the right there. After eating and 2 to 3 hours after eating, you can also check blood sugars to get an idea what category you fall in. And that'll be something that you would take on with your doctor if needed. There's a blood test that when you get another number, I know I just said one number, your blood glucose, and now I'm splitting it into 2 numbers. That's what the doctor do. But the hemoglobin A1C can be tested. It shouldn't be used to diagnose diabetes. Okay? So we don't just run the hemoglobin A1C. But if we're concerned that blood glucose is either impaired or elevated on a test, the doctor might say, hey, listen, I need to get this hemoglobin A1C. So the blood that's circulating this A1C hemoglobin is collecting some sugar, basically. If you have high blood sugar, then this A1C number goes higher in your blood. It's like a marker of what your blood sugar has been. It's not pathologic. It's not doing anything to you. It's almost like your hemoglobin is getting coated with sugar. So if your blood sugar is high, the hemoglobin has more sugar on it. I know that's way oversimplification. You can think of it. If you have a normal hemoglobin A1C, that's less than 5.7%. If you have pre-diabetes, which we talked about, where your body's not quite there yet to full diabetes, but it's a concern, it's something that we're worried about. 5.7 to 6.4, diabetic would be over 6.4%. So I put up here some ways that I like for reducing blood glucose level, but we'll have the dietitian, Kelly, will be talking more about that a little bit later. I think regular exercise is really important. 20 minutes, 3 to 5 times a week is a place to start. And I try to tell patients to be relatively simple about it. You don't have to run a marathon or a 5K even. You don't have to be lifting heavy weight. You just want to get to a point, walking, or if you have balance issues, stationary bike, that you start to notice that you're not breathing quite like you would. So I tell patients to think about if you were on the phone with somebody, would they be able to tell that you were exercising? If they could tell because your breathing is a little bit short or you can't quite finish the words because you are exerting yourself, and that's probably the perfect place to be. If you're so short of breath or you're exerting yourself so much that you can't carry on the conversation, that's not necessary to get to that point. It's just helpful you get to a point where the body feels a little bit of exertion. You can park there and stay there for 20 minutes, 3 to 5 times at the start, or you can continue to elevate that over time to more time and more days of the week. That's a good place to start. Reducing your carbohydrate intake, it's very easy to take in a lot of carbohydrates. I love chips, I love potatoes, I love cake. All that stuff's really good, but it's carbohydrates don't make you feel as full, so it's really easy to pack them in. And then the way carbohydrates are processed ends up putting you at risk for developing diabetes. So we're going to reduce our carb intake. If you take in fiber, fiber fills you up. There's a lot of other positive things that it can do for you from a GI perspective as well, but you don't need as much because your stomach's kind of full. It binds some of the substances that you don't want to absorb. They head on out the other end. So increasing the fiber consumption can help with your blood glucose. Drinking lots of water, staying hydrated. I tell patients to get some smaller plates. Okay, so if you're thinking you want to manage this blood glucose better, but you're putting in front of yourself a giant plate full of food and you're filling that whole plate, maybe that's not the best way to manage it. I'll put a lot of potatoes on that big plate. Maybe get small plates, just fill the small plate. It's the easiest way of all to cut your portions down. It's just by you want to manage your stress level. When your stress level is high, your cortisol goes up, and the thing that follows it is your blood sugar. So you want to try to do things like meditate and exercise, take time for yourself. I know it's very easy to say, manage your stress level. It's easier said than done, but the more things that you can do to try to reduce your stress, the better. Improve your sleep. Bad sleep dysregulates a lot of parts about your body. Have sleep apnea, for example, it increases a lot of risk factors for cardiovascular disease. A lot of patients are not very excited about wearing a mask or getting a sleep study. But it's come a long ways. It's really improved a lot. My dad had a mask that he argued with the mask for about 7 years before he finally settled in, and now he won't sleep without his CPAP mask. I never heard anything more hated than that mask for about 6, 7 years. Keep working on it. Eventually, it will work out. Eat healthy snacks, and you want to maintain a moderate weight. So this is up next, the body mass index. This is the WHO classification. It's a lot of different categories, but if you move over here to the right side, a normal BMI usually less than 25 kilogram per meter squared. Just to give you a sense, mine is right around 25, 24.7 or something like that. So it can be a little bit challenging because it's not easy necessarily to get there. Overweight 25 to 29 and obese is more than 30. Severely obese is 35 to 40, morbidly obese greater than 40. And this is a very high risk for a lot of other problems such as the blood glucose, cardiovascular disease. So this number, you want to try your best to get at least under 30. What are some good ways to reduce weight? I like the idea of intermittent fasting. I know that sounds challenging, but you can do a very simple form of intermittent fasting. You can just stop eating after 7 p.m. Don't eat until the next morning at breakfast, for example. That's not challenging. There are people who have windows that they're using. Okay, I can only eat 5 to 7. Or you don't have to do all that. You just say, all right, as it gets later in the evening, I'm not going to eat anything after a certain point. Think of all the food you might have taken in after that point. It's all something you didn't eat. And the stuff that you eat late at night might not be that healthy anyway. Also add a little resistance training. Muscle consumes calories while you're sleeping, while you're doing other things, while you're sitting. I'm not suggesting that you've got to get a 45 dumbbell and go after it, but a little bit of resistance, you can get those bands that you can even step on the band and go like this, or you can stretch them this way. A little bit of resistance builds a little bit of muscle, and that can help you to maintain a more healthy weight. I already mentioned using the smaller plates, limiting processed foods, avoiding refined carbohydrates, but I'm pretty sure Kelly's going to talk a little more about this later on. Getting good sleep and fiber. So very similar. You're going to see there's a lot of things that you can do, more than one of these risk factors. So how should you start a weight loss program? I think that it's very important to have a mindset if you want to lose weight. It can be very sort of discouraging, and you can work really hard at it and not get anywhere. And then you become discouraged and you decide this doesn't work. Or perhaps you send yourself way into certain diets and they're very challenging. So maybe at the outset, you want to have a different mindset. Your body is designed to be prepared just in case there's no food tomorrow, which we know that that's not going to happen to any of us, very unlikely. Your body doesn't realize that. So it says, I'm gonna take in everything I can. I'm going to put it on me somewhere, so I've got it hanging around for later. And so your body wants to keep you at a certain set weight. It recognizes as where I like me. Your body seems to say, okay, I like this weight. This is where we've been. Things are going well. But it takes a while to retrain your body to another weight. And often patients will lose weight quickly. And then because they lost weight quickly, their body really hasn't adjusted. They revert to their old dietary habits and the weight comes right back up. I can't lose any weight. This is very frustrating. So you want to have a mindset for long term. It takes a long time to really change these habits and make progress. If you look at it over a year, 2 years, 3 years, 5 years, you can make really significant changes. But in the short term, it's going to be a little bit frustrating. So you want to make sure that you're ready to start this weight loss program. Find that inner motivation saying, I want this. Like if someone else wants it for you, you're not going to be able to do it. You only can do it when you say to yourself, I want to lose weight for me, for the positive aspects. Setting realistic goals is really important. That's what I'm talking about, that you're not going to lose a bunch of weight and then just keep it off with minimal effort. It's going to take time. It's going to take sustained change. Enjoy healthier foods. So you have to change your palate, what you like. There's certain things that I really, really like, but I had to change them. The things that I used to think that I didn't like, I've become accustomed to now. I prefer. One great example would be almonds. I don't recall eating too many almonds when I was growing up, but now I'm just down on almonds like they're going out of style. You want to be active and have an active mindset. I'm looking whenever there's an opportunity to take the chance to do something active. Walking, if that's stairs, if that's actually exercise equipment, that's fine. But when you go to, say, for example, grandchildren's baseball or football, walk from the car, walk back to the car. So anytime you can sort of have this mindset, I'm going to be active, go out into the yard, garden, do activities like that. That's better than I'm going to park myself in my house or on the couch and just stay stationary. So you just change your perspective. Another number you should be interested in your blood pressure, and of course we're very interested in this. Normal blood pressure would be less than 120 over 80. But I'll be honest with you, with time, with age, your blood vessels stiffen. So when you're very young, your blood vessels are like little elastic bands. They like to expand and then contract with the blood getting pumped out of the heart. So as the heart does that little push, the blood vessels kind of expand a little, and then they squeeze back down on the blood. So they sort of dampen the pulsation. And you can get these nice low blood pressures. But over time, as our blood vessels get stiffer, the pulse pressure widens because of that loss of elasticity. So these numbers are a little bit challenging in the sense of I don't know that I would recommend necessarily everybody says, all right, I'm going to be less than 120 and less than 80. It's a great goal and it's very helpful. There are times that we might come up with some different blood pressure goals. An elevated blood pressure is 120 to 129 over 80. Stage 1 of hypertension, although being honest with you, nobody really discusses the stages, but this is, again, how these things are set out, is 130 to 139 over 80 to 89, stage 2, 140 over 90, and the hypertensive crisis, 180 over 120. There are patients who live higher, and maybe at 180 over 120, it's not truly a crisis. I don't want to anybody, but we certainly don't like that. We want to take care of it immediately. Call the doctor, get a hold of them. Not feeling well, you would go to the ER at this point, 180 over 120. The lower your blood pressure gets, the lower your risk of cardiovascular events. All the way down. Now, a lot of patients will tell me, my blood pressure is 110. Isn't it too low? Not if you feel fine. Actually, the curve of the blood pressure, the farther down it goes, the lower the risk for events until a certain point in about the 80s. And then it's called a J curve, where you start to have increased mortality. And that's probably because people have very, very low blood pressures or have end stage diseases, heart disease, or sepsis, or things like that. We can really push this pretty far down and you get a benefit out of it. The methods of reducing blood pressure. A lot of these are similar. Exercising regularly, maintaining your healthy weight. The more weight that you have, the more stress there is on your system, the higher your blood pressure. Limiting the amount of alcohol intake is important. Getting lots of good sleep, reducing stress, limiting salt, which again we'll have to talk a little bit more about. Pretty small. Another number to consider is your cholesterol. So there's 4 parts that I mentioned. The total cholesterol, you want less than 200. But sometimes there are some patients who have really high HDL cholesterol, and that's great. That's the good cholesterol. If you exercise, you raise your HDL cholesterol. If you smoke, that you lower it. So the good cholesterol can be modified relatively easily by some lifestyle changes. Bad cholesterol can be a little bit more challenging. That's the LDL cholesterol. We want this under 100 if you've never had any cardiovascular disease. If you've had cardiovascular disease, our goal is less than 70 for the LDL cholesterol. I wanted to point that out. That often LDL may be related somewhat to genetics, and there are patients whose families have LDL cholesterols. They're over 200, 250. That's a different subset, familial hypercholesterolemia. It's a pretty aggressive problem in terms of cardiovascular disease. But most folks just have elevated LDL cholesterol in the range 100 to 160, 190. Typically, if a person comes in, they have no cardiovascular risk factors. They're less than 100, I'm super excited. If they're less than 130, we talk about lifestyle modification. 130 to 160, We're in the gray zone. Maybe we talked about medication. We're over 160. And typically I'll say you probably need to be on a medicine to lower that. Diet and exercise is demonstrated to, generally speaking, in a population of folks, only reduce the cholesterol by about 10 to 15%. I got a lot of patients come in and their LDL is like 160, 170, but I want to try a diet and exercise. I always I say, okay, that's fine. As long as they've never had a heart attack or stroke. But I'm expecting in advance only about 10 to 15 minutes. Every once in a while, somebody really does a great job and surprises me, and I'm like, oh, hey, look at you. I'm happy, but most of the time you can't get that far down. So don't be too disappointed if your doctor just says, hey, we should probably start with that. Triglycerides are an interesting piece of the cholesterol panel. We want them less than 150, but the guidelines are we don't treat them until they're greater than 500. Triglycerides are little fatty substances in your blood. If your triglycerides get really, really high and they take out your blood, it almost looks like milk. So you can think of it kind of like a little milky substance. It can actually sludge and cause vision problems and heart problems when it's very, very high, like 1,000, 1,500. I don't see that very often. I see a lot of triglycerides that are, 300, 250, 200. What that really is, it's a marker of your overall sort of metabolic state. It means you're probably got a little bit of extra weight on the waist. Your blood sugar is probably just a little bit elevated. This goes along with what we call metabolic syndrome. And so I don't worry too much about the triglycerides until they get up there around 500, as much as I worry about saying, hey, look, these triglycerides are a sign that you're not taking good care of yourself, that you need to work on those lifestyle modifications. There's additional cholesterol type labs that you may have heard of or you may run across. Lipoprotein little a, CRP, and homocysteine are things the doctor can measure, other numbers that might be helpful if we don't really know exactly what your risk is. Maybe your cholesterol is in an intermediate zone. We want to get a little bit more information. Or alternatively, we've treated that cholesterol, but we're still having issues. Maybe it stays high, or alternatively, we've had more cardiac events. We might measure these additional markers. I probably should also point out in here that coronary artery calcium score can be useful too. If your cholesterol is in an intermediate range and you're trying to decide, should we treat it, should we not, you can go get a CAT scan of your chest. The CAT scan looks specifically at the arteries, and looks for calcium in the arteries. If you have calcium, then you have plaque. It's very easy for the radiologist or for the imaging to see calcium. It lights up, right? They can sort of localize it and say, all right, and they give me a number. If your coronary calcium is less than 100, then you're probably in good shape, not too much to worry about. If it's 0, you're in great shape. You're probably not going to have a cardiac event over the next 5 years, maybe less than 1%, 0.5% chance. If your coronary calcium score is 1,000, then I know that there's probably things to work on. You've got plaque, you've got atherosclerosis. I'm going to start treating that LDL cholesterol, even if it's relatively low. Let's say it's 130, but you have a coronary calcium score of 1,000. These are additional numbers that might be talking about. So similar type of ways to reduce cholesterol: dietary changes, increasing your fiber, limiting alcohol, maintaining healthy weight. Last number of the 5 that we were to discuss today is kidney function. And there's several numbers within kidney function that can be as or values, I should say, because if you have a dipstick urine test and there's no protein, that's a really great sign. So if you have protein in your urine, your kidneys may not be quite as healthy as you would like them to be, and that's a time to start working on these risk factors or discussing with your doctor what type of changes that you need to make. You're hoping for a dipstick negative for protein. You can look, if you want more specific numbers, you look at the albumin, which is protein, the creatinine within the urine. This is a UACR, that normal is less than 30. Your doctor may come up with that. You might see it in your paperwork. The serum creatinine is very helpful. It tells us how well your kidneys are processing. So creatinine is formed naturally in your body through muscle processes. It's not a pathologic substance. It's in a way kind of a waste product. And you sort of make it in a generally steady way. You're not making a lot one time and not making a lot another time. Most people's body size and muscle mass isn't that much different, so the creatinine is generally similar between individuals. So the physician can then look at how much creatinine is in your blood to help determine if your kidneys are eliminating. If your kidneys are not eliminating, it starts to accumulate. But again, it's not pathologic. It's not doing something to you. It's just a marker how well the kidneys are working. Normal male is less than 1.3 and female less than 1.2. If that goes up, it can be an indication of kidney to want to investigate that. You also can get something called a GFR, or creatinine clearance is another way to look at that. That number says what is your kidney function actually doing. So how much is it able to process? Creatinine clearance is specifically looking at creatinine. GFR is about how many mLs of blood are being filtered per minute. And end-stage renal disease, where you paralysis, stuff like that, is very low, less than 15. Normal, greater than 90. There's a lot of folks, you'll see it on papers sort of in between. As you age, your kidney function decreases naturally. It's not something that can be prevented. So, your GFR might not be greater than 90, but that's something where you would want to talk to the doctor and get a sense where I'm at. Might not be normal. So the causes of kidney disease, mainly diabetes is the biggest cause, but high blood pressure also up there. Those are the two things we've already talked about today. So these are all kind of interrelated. So I think that this moves on to someone else's slide.
Actually, how to reduce risk for heart disease right there. That's your slide.
So we talked about most of these things. You can't change your age. I would love to change my age. We try regularly, but it doesn't ever work. Your family as well. So you want to get in touch with 911 if you get chest pain, and patients generally describe it to me as pressure or a burning sensation. It lasts for easily a minute to 10 minutes, 15 minutes. If you get a sudden twinge and it just sort of hurts, that's not how the arteries work. If I'm in working on someone's artery and we block it with a balloon, they don't immediately say out. It takes good 30 seconds before I start to see the EKG change, and maybe another 30 seconds before they start to tell me the chest is hurting. I take that balloon down, same thing. It takes easily 30 seconds to a minute before the pain subsides. So you're not looking at like, okay, it's going to be kind of a starts and then it seems to get worse and worse. It generally is worse with exertion. So if you're starting to do something, it might get worse. Shortness of breath is another sign for a heart problem. That says when to call 911, but I would say that you don't have to call 911 just because you're short of breath. We're talking about severe, sudden, something that you're saying, okay, this isn't right. And another important point would be that men and women can experience different symptoms. I would say that women have a lot of heart disease, but it generally because men are a little bit more younger age, perhaps a little more dramatic. They might have their heart disease at a point when they're a provider, and it seems to be more impactful, but actually women die at a higher rate of cardiovascular disease. So you want to keep that in mind. And maybe that classic clutching of the chest may not occur, less likely to occur with women. But I do think they have similar symptoms in a lot of respects. The chest discomfort, shortness of breath, pressure that can radiate to your neck. Let's see. Now.
Hello, everyone. My name is Kelly. I'm one of the dietitians that work here at Fisher-Titus. We have 5 dietitians that are here, and I am considered the outpatient dietitian. So either physician, your provider makes an appointment, with me, or Megan is another dietitian. And tonight, we're gonna just talk about a few things, and I'm just gonna go through some general categories. You kind of have heard some, and all right, here we go.
It's to the right, the thing on the right, yeah. There you go.
There we go.
Mhm.
So what we're gonna talk about today is just small little things that you can do to make changes, just to make your heart healthier, basically. So tonight, we're gonna talk about sodium, a little bit about sugar, a little bit about fats. We're gonna talk about portions, and then some meal plans that are out there for you guys. And you guys have this in your packet, is Heart Healthy? You just wanna make sure everybody has it. It's good one reference. So the first thing I want to talk about is sodium. Does everybody have it? Just in case they need these numbers, they should be in your packet. So when we talk about sodium, the average person consumes around 3,400 milligrams a day. Well, what does that mean? Now, I don't know. What that means is a little teaspoon of salt that we have is around 2,300 milligrams of sodium. So you take your little measuring teaspoon, that's around 2,300 milligrams of salt. Most people consume a lot more than that. And I'll explain some of those examples as we go through tonight. What we like to see is around 1,500 milligrams of sodium. And for some people, that's easily achieved. And others, it's very difficult. So most sodium comes from the prepared packages. So if you're one of the people that has a lot of prepared foods at home, convenience type foods, with the packets that you have to add to the box of rice and noodles and things like that, that's where a lot of that sodium comes from. So I always tell people, just use half of that packet if you're using the salt packet. That's an easy way to kind of start this process of getting used to not having the salt. A lot of my cardiac patients would tell me, you know, I don't want to have that elephant on my chest again. I'll do anything it takes to not feel that elephant on my chest. And they tell me with the salt, it takes them a good month at least to get those flavors back in their mouth. They say it's similar to when they quit smoking and all of a sudden they could taste those different flavors. It's the same thing with salt. It masks a lot of the natural flavors. So when you slowly adjust and change, you'll be able to taste foods differently and you'll like more, like you mentioned. So going back to the sodium, I'm going to go back there a minute. And let's say we went to Arby's and we got a small curly fry. That would be 570 milligrams of salt. Let's say we had a classic roast beef with that. That would be no cheese. We're not going to add cheese to it. That would be 970 milligrams of salt. Okay. On your, I'm sorry.
Click the one to the left.
Left?
Go backwards,
Okay.
yeah, sorry.
Okay. On your slide that you have, there's some guidelines here. The label reading for sodium, the third bullet point down, said the goal for food labels is less than 20%. That is what I teach in the class. So if you have a food label and it says the percentage next to it, the easiest way is less than 20%. So if it's over that 20%, it's too much. But if you're looking specifically at the milligrams on a food like dining out, for instance, Arby's, we want to say less than 600 milligrams for that meal. Okay. So if you think back to what I said about that classic roast beef, no cheese, that's 970 milligrams. Okay. Which is a lot. Now, also, I had a patient the other day that went to Longhorn and they were coming into me because they had blood pressure issues, chronic kidney, and diabetes. So they said, well, we don't eat, salt when we eat out. We don't use a salt shaker, blah, blah, blah. Okay, so what did you have at Longhorn? I had a Caesar salad. Well, let's look it up online. Caesar salad, 600 milligrams of salt. 6-ounce sirloin he had, 530 milligrams. Remember, 600 for the entire meal, okay? His baked potato, no topping, I didn't add anything to it. We looked it up online. 2,300 milligrams of salt for that baked potato. But it's a baked potato. They roll it in salt. So, and I asked him, I said, you know, did you have bacon bits? Did you have your butter? Did you, you know, what else? Did cheese? No, just plain. He said, are you sure that's plain? I said, that's what it says. So whenever you guys go out to eat, take a look at that online if you have a chance before you go, and plan ahead. That's what I always say. So they made some changes right then and there from based just on that baked potato. So the next thing I'm going to talk about a little bit is added sugars. Added sugars is something I talk about every day. So brown sugar, corn sweeteners, honey. Yes, honey is the same thing as regular sugar. And let me back up to the salt. Regular salt, sea salt, iodized salt, they're all the same to me. Pig salt, Himalayan salt, I don't care. They're all salt to me. So when people say, oh, I only do the pink salt, okay, I don't care. It's salt. Okay. Same thing with sugar, sugar. So when you look on a label at your added sugars, I always think about this as, where are you spending your calories? Or when we talk about carbohydrates, where are those added sugars coming into play with those carbohydrates? Because I necessarily don't talk about specific carbohydrates. I talk more about those added sugars, because that's what I see people consuming a lot of and they don't realize it. So for instance, the sugared beverages and added sugars in foods, if you're going to look at the food label, look at less than 10% of the added sugar. Now, you guys remember that I said 20% on the sodium, 10% on added sugars. That's always a goal, okay? So for every 4 grams of added sugar, that equals a teaspoon of sugar. So one of my patients today came in and she consumes 3 energy drinks a day. And she had yesterday her intake, because I spent an hour with them, and we did a 24-hour recall, and she told me she's been reading online and she's researched all this. So she had 4 donuts yesterday. And so we went and looked up the added sugars on that. And she did not realize that that energy drink had 80 grams, each one, 80 grams of added sugar. So I gave her a job, and she's to report back next week of her Fruity Pebbles. How many grams of added sugar is on that food label? Okay. So we see that mainly in granola and cereals and regular yogurts, and not the light yogurts, but the regular yogurts, like the little kids' Danimals, things like that. For instance, I've had these forever, and if you've been to any of my sessions, you know I use these a lot. This is a teaspoon of added sugar, okay? Just a little teaspoon. This is a can of Coke. This isn't a bottle. This is just a normal little 8-ounce can of Coke. How much sugar is it? Or any soda, regular, okay? This is a Powerade or a Gatorade. Okay?
Does that include the 0 ones?
No,
No, it's not
good
true.
question.
Yeah.
No, zeros are zeros.
Okay.
And the G2s aren't too bad either, so I recommend those also. But I always say water's best, so I'd rather people drink water. So does that give you an idea? Just looking at that, and those numbers will help you to go home and look at your cereals, look at your packets of oatmeal you consume, look at all of those things just to see how much added sugar is in some of those products. And what changes can you make? When we look at fiber, I always say fresh is best. People always ask me, well, can I have orange juice? Am I allowed to have juice? And I say, yes. But a serving of orange juice is 4 ounces. I would rather you eat that apple or eat that orange rather than drink it. Okay, you're getting so many more benefits. It's a slower release in your body, and it also gives you that fiber. If you consume a baked potato, it has 3 times the amount of fiber with the skin versus without the skin.
But don't roll it in salt.
Exactly. So if you're also looking at a label, you're going to look at whole grain as the first ingredient or whole. So we actually have a grocery store tour that Megan does, and you can follow along with her through the grocery store tour, and the information's on the back table there in case you want to look at this more. 100% whole wheat. These are just some examples. Whole grain cereal. Now watch those added sugars again. And popcorn is a good source. Tortillas, whole grain, baked potato with the skin. So remember, fresh is best. Okay. Talking about saturated fats, you guys have heard those words before. Sometimes all these numbers get a little confusing for my patients, so I try to concentrate a little bit more on the sodium and the added sugars, and I start with that. And if they want to get more in depth, then we go to the saturated fats. I always tell people also to use those apps, those phone apps, to start recording what you're eating to see actually where the percentage of calories are coming. And you can also look on there to see how much saturated fat, if you don't have food labels and are just kind of guessing. You can also scan the back of foods with that my little stripey thing, and it'll show also on your food apps how much you put in, and it's kind of a fun thing to do. So all of that will give you the saturated fat also. And less than 6% of your calories, that's kind of for all day. That gets a little too confusing for most of my patients, so I don't go into too much of the depth of that, but 11 to 13 grams per day, or just no trans fats. Do you guys know what trans fats are? Have you ever heard of that before? So trans fats, you know, with the whole transition, you guys remember the McDonald's and the French fries and the oils changing and all of that kind of fun stuff. Well, I teach this in one of my classes about trans fats and what to look for and where it's found now in some of the food products. So, you know, if you're interested in that, give me a call and we can set up an appointment. I don't want to get into that though. I have a whole big chapter on that. So the saturated fat, we're going to kind of touch base on though a little bit, found in animal products such as meats, milks, cheese, yogurts, and butter. Okay. It can also be found in tropical oils such as coconut oil and palm kernel oil. I always say the only thing good for coconut oil is to put it on your skin. So if it has those tropical words in it, it's probably not a good thing for you. And healthier fat options. Remember though, fats are fats. No matter how you add them up, they're fats. So when we talk about fats, unsaturated, monounsaturated, we got oils. How many of you guys use corn oil, olive oil, peanut oil? That's good, good, good. Liquid or soft margarines are always going to be better. I always tell people if it's liquid at room temperature, it's going to be better for your arteries than that stuff, that stick butter sitting there. Solid temperature. Okay. And salad dressings. Look at your salad dressings. Another thing you can do is make your own salad dressing. Use the healthy oils. Now they have all those fabulous vinegars that taste great also. Raspberry vinegars and all kinds of fun things like that. Go visit some of those places that have those and see if you like some of those different types of vinegars. So foods with healthier fats. The only difference between whole milk and skim milk is the fat content. Okay. A lot of times people tell me, oh, it has all these additives in the 1% skim milk. I was told not to have that. The only difference is the fat content, calories. Also, protein sources, your meats and cheese, look for less than 5 grams per ounce or you're 93% clean. Okay. So, and again, on the back of those labels, 5 grams per ounce. And then fish, of course, we all like fish. They're just higher in omega-3s. I'm not going to go into too many of those, but it's mainly like your salmons and things like that. Okay. And then avocados, peanut butter, nuts, and seeds. You notice how I have unsalted nuts there?
Mm-hmm.
Okay, so nuts, avocados, peanut butter are all part of the fat content, all part of the fat group. So when we talk about, you know, what is the serving size of an avocado? It's actually 1/8 of an avocado. 1/8 of an avocado. So if you eat a whole avocado, that's like, I always tell patients, that's like 8 pats of margarine.
Oh, okay.
And another thing is, nuts around 6 or 8 is equal to the fat content of pat of margarine. So if you're eating trail mix, I always tell people, the only people that need to be eating trail mix is people out walking on trail, and really they don't need it anyway. Some of those little bags at Sam's Club, I don't know if you've ever seen them, they're like little bags of almonds. Some of those have, I always show them to patients and say, that's like eating 5 pats of margarine.
Yeah, Dr. Christofferson.
Yeah.
You see the margarine.
You get more fiber with the nut. So it's a healthy fat, and it's a good way to add the monounsaturated fats, but fats are fats. So I'm going to talk a little bit about portion size versus serving size. So what I try to teach my patients is also there is a difference, because I always refer to the potato chips. If you eat 11 potato chips, that's what the label says you're supposed to eat. But if you end up eating 22, you have to look at that label and double that. Okay. So this is an ounce of cheese. See this little cheese? That's what the label says to eat. That would be like a slice of American cheese. Most people, I only have 3, but most people consume at least that. And your steak, this is a 3-ounce steak. Pretty thin, isn't it? Most people consume at least an 8-ounce, 10 ounce, 12 ounce, 24 ounce. So really pay attention to what the label says and what you're eating. And it's fine if you double that, but you have to count that. Yeah, the 2 Oreo cookies versus 4 Oreo cookies. And then there's a couple little things I want to talk about. There's 2 main meal plans that people talk about. One is called the DASH diet. It's been around forever, dietary approach to stop hypertension. And what it is, it's a gradual change. So you're adding healthier foods and kind of evaluating what you're doing. So if you were to come to me, I would say, okay, tell me what you're eating now. And we're going to take 1 or 2 things and make those subtle, small changes. And I would ask you, can you do that? Sure, I can do that. Okay, so that's what we're going to work on for the next few weeks, is just incorporating that 1 or 2, those 1 or 2 things into your meal plan and adjusting what you're eating. So part of it is adding 1 serving of a vegetable or fruit each day. 1. higher low-fat protein foods. So we would take a look at some of the foods you're eating. And again, just like I kind of reviewed this tonight, take a look at some of the things you're eating and the healthy snack options that you are eating and what can you do. And this also includes foods that are higher in potassium, calcium, mag, fiber, protein, just all together. This is a very, very good meal plan, but it's based on what your calorie needs are. So I can't say you need this many because it's based on your caloric intake. And then it's also lower in sodium. So the studies that have been done on this show that you can't just give somebody, oh, potassium and a vitamin or extra calories and mag. No, it's in the food and how it's incorporated together. That's what brings down your blood pressure. And there's two different types of this dash, depending on how restrictive you want to be with your sodium. And then the Mediterranean diet or lifestyle. There's actually around 16 different Mediterranean diets that are out there. It depends on where you live in the Mediterranean. If you live on the top of a mountain somewhere, you're not going to have access to the fish every day. You're going to be eating more chicken and a little bit more eggs. But if you're on the coast, you get to have that fish every day. Okay? And so it's fish and poultry rather than the red meat. Fruits and vegetables, 3 of each per day. How many of you guys eat 3 fruits and 3 vegetables every day? That's your goal. Breads and other grains and potatoes, 3 to 6 per day, yes. Legumes, beans, peas, all those fun things, 3 a week. Nuts, 3 a week. Olive oil, 1 to 4 tablespoons per day. That's the only oil. No margarine, nothing else. And some red wine. So that type of meal plan is also something that is very interesting to me. I had a patient once come to me and tell me, I'm on the Mediterranean diet, but I've gained 50 pounds. And my doc said, I need to come see you. Well, he was recently retired. So that changes a lot in your lifestyle too, what you're doing now versus how active you were at your job. And he was working on model things in his garage. And he said to me, well, I go out there every night and give my wife a break from me, and she watches her shows, and I do my model stuff, and I turn on my TV. Okay, all right, your wife's preparing the meals now, okay. How did you gain this weight? I don't know. Okay, so when you're in the garage, do you snack on anything? Well, yeah, I take my jar of nuts with me every night. I said, what? Well, I have a jar of nuts and I fill it up and I take it out there every night with me. But I'm on the Mediterranean diet because I'm eating my nuts. See how that works? Mm-hmm. So it's incorporating those healthier choices in every meal you do. So my goal for him was to switch those out for some healthier vegetables that he liked. And he made a deal with me that he would do it. And he came back about 6 weeks later and he lost like 12 pounds. He was very pleased. I said, we're on the right track. Now, when you go to the garage, I want you to do 2 loops around that garage. So it's just those little changes that we can make. So I've covered a little bit on salt, a little bit on sugar for you, added sugars, incorporating fiber, taking a look at some of the fats that we're eating, thinking about eating out and what changes you can make when you eat out, and then also just a little bit on the dash and the Mediterranean. Yes, what about eggs? Oh, a great question. Way back when to now to back and forth. For some of my patients that have the diabetes diagnosis, we still say no more than 3 per week. Diabetes and heart disease go hand in hand. However, most of the people, we tell them now 1 egg a day. But most of my patients have scrambled eggs and bacon for breakfast. And they're eating 3 or 4 with cheese and salt and 5 or 6 slices of bacon. So that's where we have to kind of say, well, how many eggs are you eating? So good question, good question. They've changed on that, so. Yes.
Going back to the foods with healthier fat, you recommend 1% of skim milk.
Yes.
But across the board, a cup of milk, whole skim, 2%, they're about the same in sugar. Does that compromise your sugar content that you take in?
No, and we look at carbohydrates for that. So 1 glass of milk, 8 ounces, is around 12 grams of carbs. The added sugar should not be on the label there. It's not they don't usually have added sugars to them unless it's like a almondy with a flavoring in them. So 2% milk is almost 40% fat. So what they're doing is they're actually weighing it, and it's based on weight of the milk versus weight of the fat. They're tricking. Whole milk is almost anywhere from 58 to 60% fat. So out of that glass of milk, that much of it, 58, what do you think? About that much is fat. So 2%, roughly there. So that's why we recommend anyone over the age of 2, 1%. Good question.
What about almond milk or silk?
Yes, and that's why I said, look at those added sugars on there, because some of those do have added sugars. They've changed over the years. When they first came out, I wasn't too keen on them. I still like the real stuff better. But if you can't tolerate the real stuff, that's when you switch to some of those. But I always teach people to read those labels and see what sources of calcium they're getting if they're not getting it from milk. And where's your D from?
Okay, we'll hold the rest of the questions till the end, so we can see if there's some. Yeah, thank you. Those are very good.
I stayed over here. It's like she did. I can't read backwards. All right, physical activity. And almost everything that they said, and Dr. Christofferson as well said, what did he mention that was important to change most of what the risk factors?
Moving.
Get moving, exercise. It's very important. What can exercise do for you? Regular exercise can help you put yourself in control of your life. It can change multiple things across the scope of chronic diseases. Regular physical activity is one of the most important things that you can do to improve your health across the board. Regardless of your age, gender, ethnicity, or current fitness level. So if you cannot take 3 steps yet, or you can walk 5 miles right now, anywhere in between there, we can tailor a physical activity program for you to help you to gain strength, endurance, and help chronic diseases like we went over earlier. In America, half of the adults, which is about 117 million people, have 1 or more chronic disease that is preventable. 7 out of 10 of the most common chronic diseases can be favorably influenced by exercise. And 80% of the adult population does not get enough physical activity. So those are those stats that everybody talks about. What can you do? Exercise can boost your mood. It can make you happier. It's those endorphins that can get released when you do some type of physical activity. It can help your mind stay focused. It has proven now to really work positively toward keeping your cognition up and running as we age, because sometimes that's a thing that falls short. It can reduce your stress and anxiety. It's one of the best things to use. My grandmother always says, I can't tell you where it came from because she was, that was her thing, that exercise is the most underused medication in the world, and food is the most overused. And she taught me that from a very young age. It can improve your sleep. It can lower your blood pressure, all the things that they were talking about earlier. It can help your glucose levels. It can help you maintain that diabetes in an acceptable range. It can increase your energy levels. People say, well, exercise makes you tired. But if you exercise steady and regularly, it will increase your overall energy levels and ability to do more. It'll help maintain a healthy weight. It will reduce your risk of falling, which is something that as we age, we really get concerned about, is those fall risks. So exercise and physical activity can help you build balance and strength and reduce your risk of falling. It can improve your bone health, which is hand in hand with that fall risk. What happens if we have really bad bone density and we take a fall? You're really at risk for breaking a major bone, hips, legs, those kinds of things. And then it can generally increase your functional capacity. And how we measure that down in cardiac rehab is we measure it by your 6-minute walk distance. Very simple test, but what we see in an exercise program with our patients that lasts about 12 weeks is that they increase by 10 to 40% their functional capacity by a regular exercise. How much do you need? I know everybody talked about how it was good for you. Dr. Christofferson hit on a little bit, but the American Heart Association and the CDC have it set for 150 minutes of moderate intensity aerobic exercise per week. So that's 30 minutes, 5 days a week, you know, kind of thing. And it's any activity that gets your heart pumping. 75 minutes of vigorous activity. And how you tell the difference between vigorous and moderate is if you're walking with someone, say your husband and wife or your friends are walking and you can carry on that conversation, that's a moderate activity. If you get to where you're going so fast that you guys are only saying 1 or 2 words to one another, that crosses that vigorous line. I have been known to put patients in the vigorous level occasionally when their hearts are healthy enough. And then something else you need just by, instead of the physical activity or the aerobic activity, is muscle strengthening. It's very important. Dr. Christofferson also touched on that a little bit. When you build muscle, and I don't mean body sculpting, you know, lifting, that kind of thing, but when you use gentle weights to do simple exercises, it improves your endurance, your ability to control your exercise breathing better, and your overall general health. What counts? Anything that gets your heart beating. There is different activity. There's several things out there that are considered aerobic activity that you don't think of. Everyone goes to walking or jogging or that kind of thing. But swimming, water aerobics, dancing, a lot of things that people really like to go out and do are physical activity. How you get started, that's the important thing. Start small and work your way up. 150 minutes seems like a lot to people. But if you start with walk around the block, you start with lifting up. I always say to my patients who don't have weights at home, everybody's got a couple cans. Cans are about 15 ounces in weight. So you're about 1.5 pounds, start there. Water bottles full of water, or fill them with sand and they'll be a little bit heavier. So slow and steady wins the race. Giving it all you got puts more stress on you than starting slow and building up that endurance till you get to a point where you're having a good workout. If you have a chronic condition, I want you to talk to your doctor. Generally speaking, diabetes, kidney disease, heart disease, lung disease, all of those things need a doctor's recommendation for where you should start. Act on their advice. Find it. And they say, yeah, you can exercise and you should do this, this, or that. Go search out those opportunities. We have a wonderful community here. We have a great rec center. There are classes that are a lot of places that are given, churches, community centers, things like that, that give out those classes that are free or relatively inexpensive. I want you to check with your health insurance because we are seeing more and more wellness benefits or wellness programs within your insurances. And what that will do will hold you accountable. A lot of insurances, especially Medicare, are covering things like the rec center membership for a year or different gym memberships. Look out what's free because free is always best. Check your local churches and community centers for those things too. Enlist your family or your support system. Get your friends to walk with you. Husbands and wives walk together. If it makes you happy. If not, get a friend group with your friends. You never know, it could go both ways. But take that first step, because that's what's really important. Once you take the first step, it's easier to take the next step. Simple ways to move, walking. You don't have to buy any equipment. It's cheap. It's relatively safe. We have a lot of community areas where it's safe to walk. So don't go walking, like in the dark at midnight in a really bad part of town or anything. Not that we have a bad part of town, but stretching is also important. Flexibility goes hand in hand with bone health and lowering the risk of falling. So the more balanced that you are, the lower your risk of falling and having an injury due to activity. Steps are easy. Most people have them at home for free. Good handrail steps. Doing steps is an aerobic activity that engages the heart and lungs in one of the most aerobic fashion. A lot of times people will tell me when I have my patients come in, what's the hardest thing we did today? What do they usually say, Ralph?
Going up the steps.
Going up and down those steps, you make me do for 2 minutes. So start slow, take a minute. Steps are very good exercise. It builds bone strength and it builds your endurance ability. Marching in place. If you're not a good walker, you have poor balance, march in place. Sit-to stands are one of the most effective things you can do with no equipment other than a chair at home. And I don't have a chair that I can pull up here.
I'm sure Kelly can demonstrate for you.
So what you want to do is you want to use your thigh muscles, those big muscles. Those are the muscles that control your balance. And you're going to sit yourself into your chair without using your hands. Sit all the way down. And then you're going to bring yourself all the way up with just your legs. Now, if you need balance, start with your arms and then work up to where you can do it without. One of the very good, strong exercises for those thigh muscles. All activity is good activity. So we talk about NEAT, and what NEAT is non-exercise activity thermogenesis. So those kind of things that you do every day. In the house, taking your dog for a walk. They say dancing in the shower. I don't recommend that because cleaning the house. Housework can be very, very activity and aerobic induced. Yard work, mowing the grass, picking the sticks up, raking the leaves. All of that stuff is what we consider NEAT, expenditure of energy, and it's important. All activity is good activity. So I got some statistics for you. I read an article this month actually, and I tend to kind of see what's out there for exercise. But everybody knows about the 10,000 steps. Everybody wants 10,000 steps. Do you know 10,000 steps was a marketing ploy? Because in Japan, they made this little contraption that tracked your steps and they just picked an arbitrary number. So I wanted to tell you the actual stats of steps. The benefits start way before 10,000. So in just 2,500 steps a day, roughly about a mile, is enough to begin reducing your risk of dying of cardiovascular disease. When you add 500 steps to that, or an extra lap around a standard track, you lower your risk by 7% for every extra 500, until you get to 4,000 steps, which reduce the risk for early death from any cause if you just have 4,000 steps a day. If you get to 6,000 steps, you may lower your risk of type 2 diabetes, which is kind of what we were talking about earlier, that diabetes cardiovascular circle where it's all kind of interdependent upon itself. If you get to 6,500 steps, you may lower your blood pressure. Exercise is medicine. It will lower blood pressure, lower blood sugars, help you maintain a healthy weight. At 8,000 steps, you lower your risk for obesity, sleep apnea, and depression. So people don't think about what it does for your mood, your elevation, the ability to feel happy. Endorphins do a lot, and exercise will promote those. At 9,800 steps, you may reduce your risk of developing dementia by 50%. I kind of thought that'd be kind of helpful in this group. We all worry about as we age, the
You call us
forgetfulness.
demented or what?
I started worrying about it already, so. And then if you do make it to 10,000 steps, you can keep going, but at 10,500 steps, your risk of dying from cardiovascular disease is 77% lower than someone who does no steps. So those are pretty drastic numbers when you think about that 10,000, everybody's, talking about get to 10,000. Yeah, that's a great goal, but start, because at 2,500, you will start to feel benefits from that. Find your motivation. That's what I say is important. To stay healthy. You want to stay independent. You want to play with your grandkids. You want to spend time with your friends. You want to see, be strong and reduce your risk of falling. And the most important thing is you want to be able to live your best life. Exercise will help with all of those things. Any questions for me?
Or any questions at all? Does anybody have questions you want me to take up front? Oh gosh, look at that.
If you didn't already receive the handout, you'll notice that I have a get moving handout. And then I have one that has some suggested exercises. How to set realistic goals on the back of it.
But don't be shy. We got, what are sugar alcohols? That sounds like a question for Kelly. What are sugar alcohols?
Sugar alcohols, I can kind of generally tell you that it's the sugar, if you look on the back of the label, it ends like sorbitol, mannitol, it ends in OL. It will raise your blood sugar, but only, we say about half as much as a regular added sugar. The side effects of sugar alcohol are gas, diarrhea, and bloating. So we don't recommend you to have too many. So about a half scoop of ice cream of the sugar alcohol within it, about 5 grams is all. Anything more than that, and a lot of patients come and say, my metformin caused me. And then when we get to go into a little bit more depth, they're consuming some sugar alcohol.
Is there a sugar substitute that you prefer?
No, any of them are recommended. Any of the pink packet, whatever they're called now.
Yellow,
any
blue.
of-
What do you recommend? I use yellow personally, but a lot of people like the Truvia or Stevia.
Stevia, yep, that's the number 1. So any of them are great.
I read that cholesterol levels should be higher for someone over age 75. That could be either for Dr. Christofferson or everybody agree. Is that true?
Well, I don't think that there's a benefit to having higher cholesterol levels. Probably this might be getting at the question of whether taking a statin is beneficial beyond a certain age. I'm not sure that the literature or research has really answered that question. The issue really is we don't really know how long someone's going to live, an individual beyond a certain point. So I might have a 75-year-old who's only going to live for 5 more years, 3 more years. Might have a 75-year-old who's going to live to 95. My grandma just celebrated 96. So if you're 75 and you have elevated cholesterol, but you may live to 96, probably there's some benefit. And I don't think the research trials are very good at bringing that out. And so there's a big debate about taking statins over the age of 80. The other reason is that you're preventing future events. So if you take cholesterol medicine, prevent an event that's going to happen 5 years from now or 10 years from now, but something else is going to have you before 5 or 10 years. And maybe it's harder to show a benefit to medications. We often think of medications incorrectly. Doctors will sort of portray it a certain way, and drug companies, everyone, but it's not really true. In order to get a benefit from a medicine, not every single patient who takes it gets the benefit. The problem is that I don't know who's going to get the benefit. With statins, the number needed to treat with a statin to prevent one event is 17. So 17 people need to take a statin in order to avoid 1 heart attack or 1 stroke. I don't know which one of the 17 people that is. But as you can imagine, as people are aging and getting older, that they're getting closer to to dying of something else anyway, not cardiovascular disease, that it may be even harder to show a clear benefit. So the studies aren't there. I still do it if someone looks at me and seems to me to be in good health and good condition, and I think they're going to live for a while yet. Patients come in all the time, they're in their 70s, they're like, I'm reaching the end. I don't know if you're reaching. My dad, the execs had to bring my dad up again. He had like a 5-year plan for his finances. He's already passed the 5 years that he had planned. I'm like, Dad, no, you're going to make it a lot longer. People live longer. So I think it's still beneficial.
Yeah, it's not a simple question, you know, you really need to consider what your life expectancy is, you know. For that person who has terminal cancer, you know, like, hey, doc, I don't want to take all these meds. Yeah, that's a very reasonable thing to
Yes.
stop, for sure. But for, like you said, I have some pretty healthy 80 and 90-year-olds, I'll tell you. I'm like, I don't think you should stop your statin yet, you know, so it's not that simple. Here's another really good one. I am diabetic. I was recently told by a physician that after age 70 on an A1C of 7 to 8 is okay. Is that true? You want to take that or you can take that? So, I mean, it's true that the older you are, the tighter you control sugar. Lower sugar actually causes more harm in older people than high sugar. Well, like not very high, but than slightly high sugar. So I tell people they get a little bit of leeway. Same thing like Dr. Christofferson about blood pressure. It's okay to have a little bit higher sugar as you get older because low sugar causes more problems. You know, I usually tell them we definitely want them under 8, you know, but you don't have to live by the 6.5. You know, I like I said, you get a pass and you can have a little bit more leeway for that. So that is true. That is true. Did I say that? Would you say that was pretty good representation? It's because there's more side effects from the meds. If we keep throwing meds at you to get that sugar under 6.5, there's a lot of side effects. There are a lot of interactions. A lot of those meds aren't as safe when you get chronic kidney disease, like Dr. Christofferson talked about. You know, we have to make changes. So there's lots of consideration. So you are okay to have a little bit higher A1C after the age of 65 or 70. Studies also show that the tighter you control that sugar as soon as you're diagnosed, the better you are long-term for developing things like heart disease and kidney disease and stuff like that. So it's better to control tighter early versus tighter later.